download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's daily bulletin. While the protest against the Right to Health Bill entered the 16th day on Monday, IMA has announced nationwide Solidarity Day on Tuesday. The IMA announcement in this regard has come with the Rajasthan branch of IMA appeal to the national office bearers for their support by giving a call for a nationwide Bandh of healthcare facilities. Today, that is 4th April, the protesting doctors have planned to arrange a Maha rally in Jaipur, and doctors have already started a campaign to make it a major event. In a recent notification, the Telangana Admission and Fee Regulatory Committee has announced its proposal to review and determine fee structures of private, unaided professional institutes in the state for the block period, that is 2023-24 to 2025-26. TAFRC will review the fee structures for UG, PG and super specialty medical courses, nursing, BMS, BHMS, homeopathy and several paramedical courses. With an aim to improve the quality of medical teaching and reduce the gaps in learning, the Ethics and Medical Registration Board of the NMC today released the guidelines on professional responsibilities of medical teachers. Releasing these new guidelines in the public domain, the NMC Ethics Board mentioned that it will be prudent that medical education unit in medical colleges use these guidelines to train teachers. Besides, colleges and government administration are expected to provide conducive environment for teachers to function at optimal level, the notice said, issued by EMRB member Dr. Yogender Malik. Dozens of studies have purportedly shown that a daily glass of wine or mug of beer could reduce your risk of heart disease and death. But these studies are flawed. A new evidence review asserts and the potential health benefits of moderate alcohol use vanish when those flaws and biases are taken into account. The new research, published late last week in JAMA Network Open, was conducted by scientists in Canada and the UK. It's an update to an earlier review by the same group published in 2016, and it looks at data from studies up through July 2021. At best, a drink or two each day has no effect, good or ill, on a person's health, while 3 or more drinks daily significantly increase the risk of an early death. Co-researcher Tim Stockwell, who is former director of the Canadian Institute for Substance Use Research at the University of Victoria in British Columbia, said that low-level or moderate drinking is roughly defined between 1 drink per week and 2 drinks per day. That's the amount of alcohol that many studies, if you look at them uncritically, suggest reduces your risk of dying prematurely. The researchers found a slight but not significant increased risk of death among those who imbibed 25 to 44 grams daily, around 3 drinks. And there was a significantly increased risk of death for people who drank 45 or more grams of alcohol a day, the results showed. The highest risk was among people who drink 65 grams of alcohol or more a day, or more than 4 drinks. Their risk of death was about 35% higher than occasional drinkers.
Both cluster headaches and migraine have strong links to the circadian system, which is the internal clock that regulates body processes, according to a meta-analysis published in the online issue of Neurology. The meta-analysis included all available studies on cluster headache and migraine that included circadian features. This included information on the timing of headaches during the day and during the year, as well as studies on whether genes associated with the circadian clock are more common in people with these headaches. The researchers also looked at studies on cluster headaches and migraines and hormones related to the circadian system, including cortisol and melatonin. A team of researchers from the Nagoya University Graduate School of Medicine has reported that patients with a rare form of brain and spinal cord cancer, localized isocitrate dehydrogenase Y-type or IDH Y-type histologically diffuse astrocytoma, have a poor prognosis similar to the most malignant types of brain and spinal cord tumors. Their findings point to the need for strong post-operative care for patients with this type of tumor. In 2016, to improve prognosis and patient management, the WHO classification of central nervous system tumors included a new classification of diffuse gliomas based on the presence or absence of specific mutations. 2 rare types of diffuse astrocytomas are infiltrative and localized isocitrate dehydrogenase Y-type diffuse astrocytomas. Since they are so rare, there is a lack of information on whether the infiltrative or localized characteristics affect their prognosis and what this means for the patient. kidney plays a vital role in maintaining homeostasis within the body by eliminating toxic and superfluous substance in the bloodstream, including waste generated during metabolic processes through urine. Nevertheless, toxicity can also be induced in the kidney from certain medications. Recently, a research team from Postic has engineered an artificial kidney that allows for the early detection of adverse drug reactions. The Postic research team fabricated a glomerular microvessel on a chip which includes glomerular endothelial cells, podocyte layers, and a glomerular basement membrane or GBM using a single-step fabrication process. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.